Have you ever been feeling this pain in your stomach, a burning pain that sometimes radiates towards your back and can't even go away? You might be experiencing what we call PUD, peptic ulcer disease. Peptic ulcer disease is a condition that affects many people around the world, but what exactly is it and how can it be managed? Let's find out. Let's start from the basis. What is peptic ulcer disease? Peptic ulcer disease occurs when open sores or ulcers develop on the inner lining of the stomach or the upper part of the small intestine. These ulcers can cause significant discomfort and other complications if left untreated. Someone will ask, what could be the causes of peptic ulcer disease? Causes of peptic ulcer disease could include the following. Peptic ulcers are primarily caused by an infection with the bacterium Helicobacter pylori or H. pylori. Another major cause is the long-term use of non-steroidal anti-inflammatory drugs (NSAIDs) such as ibuprofen and aspirin. Smoking and also excessive alcohol consumption can also be a cause or can also contribute to the development of ulcers. Symptoms. What are the common symptoms of peptic ulcer disease? The most common symptom of a peptic ulcer is burning pain in the stomach. This pain can be worse when the stomach is empty and might be temporarily relieved by eating certain foods. Other symptoms include bloating, burping, nausea, and in severe cases, vomiting of blood or having black tarry stool. Diagnosis. How can we diagnose peptic ulcer disease? To diagnose a peptic ulcer, doctors may use several methods. These include endoscopy, where a thin tube with a camera is inserted down the throat to examine the stomach and the small intestine, and tests of H. pylori infection can be carried out as well, such as breath, blood, or stool tests. Treatment. What are the treatment options for peptic ulcer disease? Treatment for peptic ulcer disease often involves medications to reduce stomach acid and protect the stomach linings. These include proton pump inhibitors, H2 receptors antagonists, and antacids. If H. pylori infection is present, antibiotics are also prescribed. Lifestyle modification or changes such as avoiding NSAIDs, which is non-steroidal anti-inflammatory drugs, quitting smoking, and reducing alcohol intake or abstaining from it completely are crucial for healing and preventing the reoccurrence. Complications. What are the potential complications if peptic ulcer disease is left untreated? Untreated peptic ulcers can lead to serious complications such as bleeding, perforation, which is basically a hole in the stomach wall, and gastric obstruction, where there is blockage in the stomach. These complications can be life-threatening and requires immediate medical attention. So don't wait till it gets complicated before you see your doctor. Prevention. How can you prevent peptic ulcer disease? Prevention of peptic ulcer disease involves managing risk factors, which includes avoiding long-term use of NSAIDs, quitting smoking, moderating alcohol consumption, and maintaining good hygiene to prevent H. pylori infection. Eating a balanced diet and reducing stress can also help keep your digestive system healthy. In conclusion, what are the key takeaways about peptic ulcer disease? Peptic ulcer disease is a manageable condition with the right treatment and lifestyle changes. If you experience any symptoms, it's important to take medical advice promptly. Remember, a healthy lifestyle can go a long way in preventing and managing ulcers. Thank you for tuning in. If you found this video helpful, please give it a thumbs up, share with others, and subscribe to our channel for more informative content on health and wellness. Stay healthy and take care.